everyone. I'm Barbara Hamley. Lawmakers have been busy creating laws to combat the effects of the coronavirus pandemic, with President Trump signing a bipartisan $2 trillion measure that sends direct aid to Americans, provides funding for hospitals, increases unemployment benefits, and helps businesses stay afloat to avoid a complete collapse of the economy. In the thick of it, Congressman Bobby Scott, representing the 3rd Congressional District of Virginia. Up next on Another View, a candid conversation with Congressman Scott on coronavirus and other issues facing our community. Stay tuned. Another View is coming up next after this news from NPR.
Discussing today's topics from an African-American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Hamley. First, let me say a warm and heartfelt thank you to everyone who contributed to WHRO Public Media during our Giving Tuesday event this week. Your generosity will help us to continue to bring you programming that you trust and depend on as we all navigate our way through the coronavirus pandemic and beyond. And so we are so very, very grateful. One of the negative effects of our need to stay at home during this crisis is the unfortunate increase in domestic violence. I've heard from both the YWCA Southampton Roads and the Samaritan House in Virginia Beach about the increased need for shelter for victims of domestic violence. And I'm sure it's the same for all of the domestic violence shelters in our area. 1 in 3 women experience domestic violence in their lifetime, and African American women experience it 35% more than their white counterparts. They're asking for your help. Reach out to the YWCA Southampton Roads at ywca-shr.org or Samaritan House at samaritanhouseva.org. And in full disclosure, I am the immediate past chair of the board of the YWCA for Southampton Roads. Before we get to our guest today, too, we also want to give a congratulations shout out to Mayor McKinley Price of Newport News. He was just sworn in as the new president of the African American Mayors Association. Mayor Price is the first African American to be elected mayor in the city of Newport News. And he says during his new tenure, the arduous task of being local leaders during this critical time is that we have to work to solve the imminent dangers of the COVID-19 pandemic while also protecting and investing in sustainable solutions for future generations. Now, the African American Mayors Association is the only organization exclusively representing over 500 African American mayors from across the United States. So congratulations, Mr. Mayor, and we wish you well in that new role. Our guest today needs no introduction, but I'll introduce him anyway. He is the chair of the Committee on Education and Labor, and he is a member of the Committee on the Budget. He represents the 3rd Congressional District of Virginia, which covers all of Franklin, Newport News, and Portsmouth, parts of the cities of Chesapeake, Hampton, Norfolk, and Suffolk, and all of the county of Isle of Wight. He is the first African American elected to Congress from the Commonwealth of Virginia since Reconstruction, and only the second African American elected to Congress in Virginia's history. Please welcome to Another View via phone, because we are social distancing, Congressman Bobby Scott. How are you, Congressman?
Barbara, I'm doing well. Thank you very much. Good to be with you.
Good. It's so good to be with you also. So before we get started, just want to know, how are you and your family and your staff doing during this pandemic? Is everybody okay?
Everybody's okay so far. Everybody's socially distanced. Everybody's working from home, and we're as busy as we ever were. I mean, it's just I'm on conference calls, sequential overlapping conference calls all day. So it's been, I've been busier during the pandemic than I was before.
Yeah, well, you really are in the middle of everything that is going on. And so the House and the Senate, you were able to come together. You created this $2 trillion measure to help Americans cope with the pandemic. So my question to you is, are you disappointed that it seems apparently that a lot of the money is not reaching the people who need it the most?
Well, a lot is reaching the people that need it the most, but a lot isn't. the PPP, the Payroll Protection Program, which was a major loan aimed at small businesses, ended up getting gobbled up mostly by big businesses. A lot of the small businesses, beauticians, barbershops, and things like that really didn't get much at all. That was a disappointment. We came back with another round after they ran out of money. And the second round was better than the first, but still most of the groups that we're really aiming at have not been able to get funding. Some have, but most of them haven't. And that's been a disappointment. In fact, we're looking at other ways of guaranteeing that people can keep their jobs without having to go running to banks, which tend to support the most well-connected people first.
So, this isn't the first time that we've had to have these kind of bailout opportunities from the federal government to keep the economy going and so forth. And it seems that this is always an issue. I mean, is there ever any discussion as you guys are putting together these laws about distribution? And what do we need to do to make sure that those who really, truly need it actually get it?
Well, if you look at this package, although the payroll protection plan didn't go as well as expected, a lot of other things did. Where the rollout is slower than we'd like, but every adult gets $1,200. Every dependent child under 17 gets $500. So a family of four, gets over $3,000. It can get $3,000 under that program. A lot of the checks have gone out. They're still going out. It's taken longer than we'd like, and people need the money now. They don't need it 3 months from now. They need it now. But that's something that has not been in previous bailouts. The unemployment compensation, where people lose their jobs. The enhanced unemployment compensation is new. The $600 plus up from the federal government if you receive Virginia's unemployment compensation, which tops off at $300 and some, you get an additional $600 add-on from the federal government. That means that most workers making under about $50,000 a year will have their paycheck pretty much replaced. Some, in fact, will get more on unemployment than they were making before. So that's a group, people who've lost their jobs that have usually never gotten much help. We also expanded it to cover people that have never gotten unemployment. Gig workers, self-employed, independent contractors have never been able to get unemployment compensation. And now if they've been put out of work, they can get unemployment compensation, including the extra $600. So that has landed where we wanted it to land. It regrettably has been slow because of the tidal wave of claims that came into the Employment Commission. They haven't been able to process them as quickly as we'd like. But the ones that have gotten through, they're benefiting, and the ones that as soon as the Employment Commission can get the checks out, that's a group that has never received any help in a bailout like this.
I was just getting ready to ask you about that. So you answered my question about whether or not it was anticipated that on the state level that there was going to be such a problem in terms of processing. But that's just something we have to deal with. The problem on processing is that the previous record nationally on unemployment claims was about 600 and some thousand a week. That was in the 08-09 recession. They hit 600 and some thousand a week. We've had weeks, the last few weeks, this week it came out today, 3 million, 4 million, 6 million, 6 million, 4 million, numbers that have never been seen before. So the Employment Commission is coming behind. But people need that money now, and they're working as hard as they can, and we recognize the frustration.
but as soon as they can catch up, and it came all at once. I mean, they came from. They went up 10 times to almost 100 times what they usually get, and 10 times the previous record. Obviously they're having trouble processing them, and people are predictably frustrated as we provided all of the benefits. There is one good thing, that when you get your benefits, they're retroactive to when you lost your job, so you don't lose the money, but you need it May 1st when rent was due. You don't need it May 20th when they're trying to kick you out.
Yeah, exactly. Well, let me give out the phone number so that people can call in if they have questions to ask you, Congressman. 440-2665 or 1-800-940-2240 are the numbers to call to if you have questions for Congressman Scott. Give us a call, 440-2665 or 1-800-940-2240. Congressman, you had a call this morning with representatives from Virginia and Maryland to talk about priorities because you're looking at even more legislative response to COVID-19. Can you tell us anything about that call this morning?
Yes, we had several representatives from Virginia and Maryland talking to regional press, and we're talking about things that still need to be done. We've done a lot, but there's still a lot that needs to be done. One is that workers, I chair the Education and Labor Committee. We have jurisdiction over, obviously, education, employer-based health care, and labor issues. Under education, I guess under everything, the number one priority that everybody has expressed is that we need to support state and local governments in their revenue shortfalls. With business income going down, the business taxes are way down, and we've seen in Virginia exactly what happens when you have revenue shortfalls. Because when the General Assembly ended, it ended before the shutdowns occurred, and they reconvened to consider governor's amendments after the revenue had been projections had been revised. Based on those revised estimates, just looking at the education budget, the teacher salary increase, 2% increase, was lost. The additional counselors, K through 12, was lost. One college lost $100 million in construction. Additional money for high poverty schools evaporated. I mean, all of that's just in the Department of Education. That's because states can only balance their budget essentially by cutting back on spending or laying people off or canceling contracts and letting the contractor pay the people off. They can't balance their budget. So if we expect education to be funded at a reasonable level, and they actually need more money because distance learning has more challenges than before, we need to make sure that the state and local governments aren't cutting more than we're appropriating for education. So support for local and state government was extremely important. The need for workplace protections under OSHA, the Occupational Safety and Health Administration does not have enforceable standards to protect workers from infectious disease. They have the authority to promulgate the regulations, and there have been pending regulations for 10 years that haven't been promulgated. They can do it on an emergency basis. People need to be protected. You've had outbreaks in nursing homes. OSHA has not come in with enforceable regulations on how workers in nursing homes can protect themselves. Meatpacking plants all over the country, there have been outbreaks. There have been guidelines, but nothing enforceable. You've got prisons, nothing enforceable. And we need, if we expect workers to go back to work one day, we need to make sure that those workplaces are safe. And another provision we're looking at is what's called COBRA. If you lose your job, you lose your insurance. But under what's called COBRA, COBRA, you can pick up your premiums and pay them and maintain your health insurance. Well, the premiums could be $500 to $15,000, $500 to $1,500 a month. If you just lost your job, you don't have that kind of money. And we need to subsidize it. We had a program like that in the 08-09 recession bailout. We subsidized 2/3, and most of the people couldn't afford the 1/3, so that didn't do much good. The only way to actually maintain the subsidy meaningfully is to have it at 100%. If we don't do it, people will have to go into the marketplace to get insurance or go on Medicaid. If they don't have a job, they'll probably qualify for Medicaid. The problem with that is that they'd have to give up their provider network, get a new provider network. They might have to start a deductible all over again. And then at the end of 3 months, when they get the job back, they have to tell their new providers goodbye and maybe even start up a new deductible again. I mean, that's why put people through that. So we're trying to let people maintain their health insurance. So those are 3 things that I'm working on specifically. But the major issue that we're working on, the major priority, is support for local and state government.
Okay. 440-2665 or 1-800-940-2240 are the numbers to call if you have questions for Congressman Bobby Scott. Arnold joins us from Elizabeth City. Hi, Arnold. You're on the air.
Yes. My question was, I live in Elizabeth City, but I work in Virginia. I do contract as far as commercial cleaning. So my question is, due to the virus, some of the business have shut down. So where do I apply for unemployment? Is it North Carolina or Virginia?
Good question.
Where did you say you live? Where?
He lives in Elizabeth City, but works in Virginia. And so he wants to, and he's an independent contractor. Yes, self-employed.
If that's a difficult question because it's kind of hard to figure out what his place of employment is. I would start with the.
He said that he
North
works
Carolina.
in Virginia. Arnold, is that correct?
Yeah. Yes, I do work in Virginia. The companies I clean is in Virginia.
So he does janitorial services, cleaning services.
If he's an independent contractor, I'm not sure exactly where that would be, but it would either be North Carolina or Virginia. Apply, because if the business shut down and he doesn't have any business, he would be eligible for unemployment compensation under the expanded eligibility. It's something we've never had before. If he's an independent contractor, I'm not sure exactly where that would be, because he could be doing work in North Carolina. He could be doing it in Virginia. If he would apply in one or the other, just apply. They would be able to answer the question. And if North Carolina is going to accept the application and accept the loss of income, that'll do it. If they won't, then try Virginia.
Arnold, where is your business license?
It's in Virginia. I'm not doing any work in North Carolina. All my work is in Virginia.
Okay. Well, if you start off in Virginia, that's a good question. If your business license is in Virginia, start off in Virginia, apply, and just make sure they know you'll have your residence, so they'll know where you live, and you can. They'll ask for your business records so you can show your loss of income, and they will be able to determine that you are eligible for unemployment compensation under the expanded eligibility, and they will calculate how much you get under Virginia, and then add on $600 from the federal government as your total package. It would be retroactive back to when you started losing when they shut down and you lost your income.
Okay, thank you, Arnold, for the call. I appreciate that. 440-2665 or 1-800-940-2240. Lori joins us from Virginia Beach. Hi, Lori. You're on the air.
Hi.
Hi.
Hey, yes, I have a quick question. So I understand there's a lot of new jobs right now for people to work as a contact tracer. Where would you apply for those jobs? And do you have to be employed by the Department of Health right now to apply for those?
Okay.
That's been
Go ahead, Con.
that's been worked out now. The idea of contact tracing is a major effort and a major tool in allowing states to open back up. The idea is that you will test people at a rate significantly higher than the rate we're testing now. The national estimates are that we'll have to test 2, 3, or maybe 5 or 10 times more tests than we're doing now to get anywhere close to the level of testing necessary to protect us. The problem is that we have to discover people who are not symptomatic. People are contagious before they show any symptoms. And so if you wait for somebody to show symptoms, they could have been contagious for up to 2 weeks and spreading it all around. The people they've infected are spreading it around. So by the time somebody shows up with some symptoms, it's all over town. And the idea of contact tracing is that if you discover somebody that's positive, you go back and check all the people they've been in contact with and test them to see if they're positive, even though they show no symptoms. This process takes a lot of people. They estimate that we need to hire nationally about 100 to maybe 200,000 people. At this time, there aren't enough tests to make that process worthwhile. But as the tests start ramping up, in the next bill, we will have appropriations for training, and the training of contact tracers apparently only takes a week or two. But we need resources to train and to deploy. The expectation is that they may be deployed through the health department or the local community health clinics, maybe community action agencies, maybe hospitals. We don't know exactly how, and there may not be a national model. But that process has not it hadn't started yet, primarily because we don't have the availability of tests. But when it gets going, we should be hiring about 100,000 people to perform that task.
Okay. Thank you, Lori, for the call. We appreciate it. If you're just joining us, we're talking with Congressman Bobby Scott, representing the 3rd Congressional District of Virginia. We'd love to take your calls at 440-2665 or 1-800-940-2240. Let's talk to Judy in Portsmouth. Hi, Judy. You're on the air.
Hi.
Hi.
How are you today?
Okay. How are you?
Good.
Good.
So I was listening about the question about contact tracing.
Mm-hmm.
I've been looking into that, and just yesterday I saw a post by Johns Hopkins University that they are going to offer an online training certificate program that will be you can take and then use as your certification to apply anywhere in the country for that job.
Mm-hmm.
So they said that they would be releasing the dates for the online training within the next 2 weeks. And so that's as much information as I have at the moment. I have, you can go on Johns Hopkins University Public Health School, and they have a site that they'll send you updates and alerts, and there's a newsletter they send out like every week or every other day. I haven't been on it long enough to know what the frequency is, but that's a resource.
Okay, Judy, thank you so much for the call. Congressman, do you know, will people need certifications in order to qualify for that job?
Yes, and Johns Hopkins has an excellent reputation, but I'm not sure that every state will necessarily accept that particular certification. We have to work on that. legislation that we're anticipating will have funds for training the workers so that they can get a certification. And we're trying to figure out exactly who's going to do the hiring, who's going to do the training. How do you make sure that you get the right people hired and trained? Because some of this is culturally sensitive. You're going in asking people for sensitive information, so you have to be able to talk to people. Mm-hmm. Some people can do it better than others. It's not a technical skill, but it is a skill that if you don't have it, you don't have it.
Yeah.
So we want to make sure that the right people are being trained so that the job can get done. Johns Hopkins, like I said, has an excellent reputation. So their program may well be the model, but we would expect CDC, the Centers for Disease Control, to also be involved in establishing the curriculum.
Okay. So, Congressman, we know that African Americans are disproportionately affected by the virus, and all of this has pointed out some glaring inequities in our healthcare system as well as other systems within our country. So, once we get through this pandemic and you're working on new legislation, will your focus change at all in terms of trying to level the playing field in terms of these inequities?
We've been working on disparities in healthcare for many years. In the Affordable Care Act, Obamacare, when that passed, there were significant provisions in there, and in fact, we established a center for dealing with disparities. A lot of it is insurance coverage. Lower income and minorities tend to have a less incidence of insurance coverage. We want to make sure if everybody's covered. To the extent we can cover more people, we will be addressing the disparities. More research is needed, and there's an effort to make sure that all ethnic groups are included in research trials. So if there are some differences, they can be found. There's efforts to train physicians. There's a concept called implicit bias. That is, you have you're actually discriminating against somebody without even knowing it. There's evidence that in treatment of coronary disease, heart attacks, and things like that, African Americans tend to get less aggressive treatment than others. And you don't know why, just based on the same objective criteria. So there are a lot of things, yes, that we've been working on all along, and that we will continue to work on. And some of them are very difficult. And one of them is insurance coverage. The Medicaid just got expanded in Virginia the General Assembly session a little over a year ago. Effective in January. Most of the southern states have not expanded Medicaid, and that's where a disproportionate number of African Americans live. And so there's a disproportionate number of African Americans without any health insurance. The correlation between bad health outcomes and health insurance is well known. If you don't have health insurance, you're more likely to have problems, less likely to seek preventive care, less likely to get good treatment. You've heard people say, well, don't worry about it. You can go to the emergency room for treatment. Yeah, but if you have insurance, you can find cancer when it's at stage 1. Exactly. If you have to go to the emergency room, it's gotten to stage 4. And so you wonder why those that without insurance have a much higher mortality rate. That's because they didn't have the screenings and things like that. So I mean, there are a lot of things we've been working on all along, and we'll continue to work on them. And this pandemic has exposed a lot of the disparities that a lot of us knew were there already. And let me tell you, the pandemic has also exposed disparities in education. As chair of the Education and Labor Committee, I was talking to a friend who lives in a wealthy suburb of Atlanta. He said his son was his son's school closed on Friday. Monday, his son was online getting instruction from his teacher on Monday.
Mm-hmm.
His brother lives in Warrenton, Virginia. He said his nephew hadn't gotten any instruction yet. That was a couple of weeks ago.
Wow.
And so you've got disparities. Now, some have just closed the schools down for the school year. That means they have no obligation to deal with anything. There's a concept called summer slide, and that is a concept where low-income students during the summer actually regress up to 2 months. So that the beginning of the year, you're just catching up to where you left off. The summer slide, when you start the summer 2 or 3 months in advance, is just going to get worse. So there are a lot of things, a lot of underlying problems we have in disparities in education that we're looking to deal with. First of which is seeing if we can't have some summer programs so that the summer slide gets checked and people can start getting ahead. Other kinds of programs, special education, disabled children need extra help. They're not even in school. It's going to be more expensive. There are a lot of things, disparities in education that have been exposed, and we need to be working on those too.
You know, when you speak of education also, I know that a lot of HBCUs were not as adept at being able to move to online learning as some of the other institutions. Have you heard from those schools and the special challenges that they're facing?
Well, some have challenges. Others have done much better. We had a provision. We had a provision in the last bill that passed in the CARES bill that provided assistance for education, half K through 12 and half higher education. And part of the higher education money, there was a small set aside for HBCUs. That money for colleges, half was to go to support students. A lot of students were on campus. That was their housing for the next few months. Campus is closed. Now they got to scramble and find housing, or they could go home. But if they don't have plane fare to Detroit, they can't get home. So we provided that half of the money had to go to support the students during that interim. A lot of colleges were given refunds. So the students, half went to students, the other half went to the colleges. They're trying to maintain the campus. The people have left the dormitories, so they're not paying room and board. They're not paying. So they still have debt service on the dormitory. So I mean, all of the colleges are suffering. They need additional funds, and they've received allocation. The local colleges, all of them, received millions of dollars. And that'll go a long way into keeping the faculty intact, making sure that the campus is kept up and the students are taken care of. Student loans, that was a problem before this all happened. We've given relief on federal student loans. We don't have jurisdiction, that the Education Committee doesn't have jurisdiction over private student loans, but we need to get them included in some of the relief. So there's a lot we've been doing on higher education generally, but the $1 billion for minority-serving institutions, most of which went to HBCUs, will go a long way into trying to deal with the inherent inequities there.
Okay. And, we also know that another one of the issues that we're facing, and this is a question from one of our folks on Facebook. So they're talking about double-digit unemployment continues for all African-American males, for all age groups within African-American males. And what kind of programs, or why does it seem like that group does not get some sort of special attention as other groups get as you look at unemployment and ways to bring people back to work?
Well, they're looking at double-digit unemployment, almost 10% unemployment through the end of next year. I'm not sure if they'll publish an unemployment rate tomorrow, but they expect it to be in the 20% range. It could get up to as high as 30%. I mean, numbers you haven't seen since the Great Depression, but not the Great Recession in 08 and 09. I'm talking about the Great Depression in the 1930s. You haven't seen numbers like we expect to see coming up in the next week or two. We need to support job training to make sure people can get jobs, maintain the unemployment compensation, so that if you are unemployed, that if you're, quote, unemployed, that means you're part of the labor force. It means you're looking for a job and eligible and available for work and presumably eligible for unemployment compensation. So we need to make sure that those benefits are as high as possible. We have to. One of the things we've been focusing on all along is trying to have people maintain their paychecks, and the unemployment compensation, the $1,200, and there's discussion of another round of payments, and the number most frequently mentioned is $2,000 for adults, $1,000 for dependent children, and there's a category of people we somehow left out, and that is it's $1,200 per adult and $1,200 and $500 for every dependent child under 17. But if you're a dependent child over 17, like a college student, you not only don't get the $1,200, you don't even get the $500. Exactly. So I don't think that was intended. At least the $500. So there are a lot of people that they got left out. But the numbers, most of the people are talking about is $2,000 for adults and $1,000 per child, and maintaining the $600 extra over and above the unemployment compensation. So that's what's in discussion right now. That's what's in this discussion. We have the $600 plus up on unemployment compensation, but it's frustrating because the Employment Commission is just facing a tidal wave of claims. Yeah. And they're doing the best they can, but it's frustrating because people needed that money the first of May. Our phone lines are lit up, so let's take some calls. Beth joins us from Virginia Beach. Hi, Beth. You're on the air.
Hi. I tuned into your program in the middle of a conversation, and it had to do with those of us workers who are independent contractors. And just wanted to put out the information that I just recently received both the back pay from the state as well as the federal government under the pandemic unemployment assistance. Now, I initially applied for unemployment through the state and was rejected. And then I applied through the federal government and for the what's called the PUA, for those of us who are 1099 independent contractors. And it took about a month before I got a response saying that my request had been approved. And I think 2 days after I got the letter in the mail is when the money hit my account. So what I was advised initially, and this was from Senator Mark Warner's office, was that you had to, in Virginia, you had to apply for the state first and be turned down, and then apply through the government program for PUA, Pandemic Unemployment Assistance. And that is the $600 a week that was voted on with the CARES Act, which Representative Scott has been talking about. Okay, Beth, thanks so much for the call and for sharing that information. Did you get a little piece of state unemployment too? Yes, I did, and it shocked me. So she did get both. Because the process is, as independent contractors, they're trying to streamline it.
but you applied, you're not eligible for regular unemployment. You apply the other way, and they will calculate what your Virginia unemployment compensation number would be. If there is as much as $1 of state unemployment, that triggers the $600 federal plus up. If you're entitled to any Virginia unemployment at all under the expanded eligibility, and it goes. How far back did they go in terms of payments? In terms of weeks of payments?
They went back to the week of March 15th.
So the week of March 15th, yeah.
You got $600 some dollars. You got $600 a week plus Virginia from March 15th till just a couple of days ago.
Correct. I got 6 weeks back pay, so to speak. Yes.
Yeah.
And the one thing that is important, to note is that the state has lifted the requirement for filing weekly, but if you're getting the federal assistance through the PUA and the CARES Act, you are required to file weekly regarding looking for work.
Okay. All right. We've got.
Wait a minute.
Go ahead. Go ahead, Congressman.
I thought they'd waived the work search requirement.
They did on the state level, but on the federal level, it's not.
You still have to file weekly.
Okay. I'm going to check on that because we were told that you did not have to have the work, at least temporarily, the work search requirement was not there. So let me check on that. I appreciate your call, and I'm glad that you finally got through.
I am too. Thank you very much.
Thank you
for all you're doing. Be safe.
Thank you so much, Beth. We appreciate it. Let's go to Anthony in Norfolk. Hi, Anthony. You're on the air.
Hi, thank you. Congressman, I am a truck driver who's been working for the same company for nearly 2 years. And when this epidemic took place and my son, under the age of 18, was sent home, his mother was able to care for him for several weeks. I stayed out on the road doing my job. She asked for some relief by requesting Dad come home and take over, which I did do. And I'm at the end of 2 weeks sitting at home taking care of my son, which is my privilege. But I reached out to my company, which has less than 500 employees, and I asked them what resources are available to me. Their response was, you have personal time off, also known as vacation time. You can use that. And I went to our digital payment application, and I noticed that there is 80 hours sitting there, and it's labeled Family First Paid Sick Leave. As a truck driver, I don't normally earn sick leave. I see that it's there. Our company didn't even tell the employees that this was available. And now that I've reached out to ask for available resources, they're denying that it's even there. What are my options? And not losing my job for calling them out, but it seems as if they're hiding it. Is this a federal benefit that's available to us, or is it just mandated by the federal government that the employers provide this? I don't know what to do.
Do you belong to a union?
No, sir.
Okay. Well, a union rep would be the best thing to get involved in. The Families First. The Families First was part of the either second or third bill that we passed. I think it was the second bill that we passed that provided for paid leave if your child is out of school. Paid family leave if your child is out of school, and that's what when it said Families First. That's the bill they were talking about, and you get you get 12 weeks, 2 unpaid and 10 paid for being at home with a child out of school. The first 2 weeks, if there's sick leave or your child's out of school, that can be paid too under another column, but it's a little complicated. Most of the people have been just going to unemployment compensation, But you are entitled, if your child is out of school, for leave to be with to care for your child. Where do you live? Where do you live?
Norfolk, Virginia.
Do you know whether you're in my district or Elaine's district?
I do not.
Congressman, so that we can get to some of the other calls also, could we have Anthony call your office that they could probe a little bit further?
That's what I'm trying to get to. If he's in my district, this call, my congressional office is 757-380-1000, and we can look into it. But we did pass legislation to provide that when if they called it Families First 80 hours. That's what they were talking about. The legislation that passed that gave 2 weeks leave, and then there's an additional leave after that. It's a little more complicated.
Okay, Anthony, give his office a call, and they'll be able to go into it more deeply with you. Thanks so much for the call. We appreciate it.
Thank you.
Okay, Melody joins us from Virginia Beach. Hi, Melody. You're on the air.
Hi, Barbara.
Hi.
My question is, I work in an outpatient medical clinic, and we've had a reduction in hours. So I was full time, and I'm now working 7 hours 1 day a week. I was just wondering if I would qualify for the $600 benefit, not applying for unemployment, but just the CARES Act benefit for a reduction in hours.
Okay, let's ask the congressman. Do you know, Congressman Scott?
Unemployment compensation technically doesn't do hours, it does dollars. If the reduction in your income qualifies you for any unemployment compensation, you're entitled to the $600. So contact the the Employment Commission and give them your before and after salary, and they can determine whether or not you are entitled to any Virginia unemployment compensation, and if so, the $600 comes with it.
Okay, thanks so much for the call, Melody. We appreciate it.
Thanks,
Congressman, you're welcome.
Thank you.
Congressman, you are working on, you and other representatives from the House and the Senate, you're working on something called Relaunching America's Workforce Act. Can you tell us what that's about?
Right, it's a major job training initiative. A lot of people are losing. We've got so far, just in the last couple of weeks, over 30 million people who've lost their jobs. A lot of them will get the jobs back. And regrettably, a lot of them will not. They'll be looking for new jobs, and we want to make sure there's job training available so that they can get the best jobs they can qualify for. It improves funding in a number of different areas, basically through the Workforce Investment Boards. There's a board. There's a program on the peninsula. There's one on the south side, and they coordinate job training efforts. Part of their job is to ascertain what jobs are needed to be filled, and making sure that when people come in, they get trained for jobs that actually exist. But the extensive investment in job training is what the bill does.
Okay, so you're still working on that right now. I know you've held a series.
And actually, we're trying to make it part of the next COVID-19 bill legislation, but I think we may just do the contact tracers part of it.
Okay. We just found out Lieutenant Governor Justin Fairfax is joining us. Hi, Lieutenant Governor. How are you?
I'm great. How are you doing?
Great. Thanks so much for calling in. What can we answer for you?
No, my pleasure. I was just going to thank Congressman for his work at the federal level and just talk about the state and federal coordination, if that's okay.
Oh, absolutely.
Okay, that's all I wanted to do. I saw it. He was on, and it was a great discussion. So I just wanted to thank him and encourage everybody for the work they're doing.
Okay, and you want to talk about the coordination between the state and the feds?
Yes, absolutely.
Go right ahead.
Okay, are we on?
Yes, you're on.
Oh, great. Well, thank you so much. This is great. Congressman Scott, I just wanted to call and say thank you so much for your tremendous leadership at the federal level. We are grateful for all that you've done to help support Virginians and everybody nationwide. I heard you talking about the unemployment insurance, the extra $600, which is really significant for everyone who's going through a very tough economic time. And also, at the state level, we are, working hard and doing everything we can to flatten the curve. As we've talked about, it's been a twin crisis, both economic and healthcare. And so we appreciate all, 8.5 million Virginians and what they're doing to keep everybody safe, but also understand they're going through a very tough economic time. And Congressman, I just want to thank you from day one. You've exhibited leadership. You took this challenge really head on, and we've seen the state and federal governments coordinating very well. So very grateful to you. Keep up the tremendous work and look forward to continuing to work with you to get through this.
Fantastic.
Well, thank you. Barbara, the Lieutenant Governor and I have been working on a lot of issues together. On Obamacare, expanding Medicaid. Last year, he cast several tie-breaking votes that made the expansion possible. And this time he cast a tie-breaking vote to make sure the Virginia minimum wage was increased. The House has passed an increase in the minimum wage, going to $15 an hour by 2025. The bill that they passed is on track to do exactly the same thing, and it wouldn't have been possible without his tie-breaking vote. So we've been working together on a lot of different issues, and I appreciate his comments.
Well, fantastic. Go ahead, Justin. We got about 30 seconds left.
Thank you, Barbara. Thank you, Congressman. And I just want to say, it's at moments like these, unprecedented times, when you really appreciate having a leader like Bobby Scott. And I know everybody, even in good times, loves having great leadership, but now it is essential. And I got to tell you, you better appreciate Bobby Scott now more than ever. He is an extraordinary leader. He's my friend. And thank you, Bobby, for all you're doing. Please stay safe on Capitol Hill, and we will get through this together.
And with that,
thank you. Keep up the good work.
And thank you, Congressman Scott, for joining us. We really appreciate it. We are out of time. I cannot believe how quickly this hour has gone by. Thank you so much for joining us, and we appreciate all that you're doing. And thank you for joining us for this edition of Another View. If you'd like to hear this show again or share it with a friend, please visit our website, anotherviewradio.org, and you can download the podcast. We're on Facebook, so you can like us, and you can find me on Instagram and Twitter at Barbara Ham Lee. Next week on Another View, the Another View Roundtable with their thoughts on reopening Virginia, Joe Biden as the Democratic presumptive nominee, and what the coronavirus pandemic shows us about racial inequality in this country. Always a thoughtful and insightful conversation from our roundtable. Our theme music was composed and performed by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our calls. I'm Barbara Ham Lee. Happy Mother's Day to all the moms out there who are working, homeschooling, cooking, cleaning, and keeping the family together during this pandemic. We salute you. Take care, everyone. Stay safe, and join us again next Thursday at noon for Another View.